So just to introduce the network then, we bring together people from a whole group of different organisations. We've got 8 universities plus government departments, Public Health England, DSTL, and a whole raft of industry partners who are supporting us in this network. So it's a very interdisciplinary network, looking at a whole range of things from the very fundamental research all the way through to practical delivery in the built environment. And these are the key people involved in the network. This is the investigator team, who are across multiple different universities with various different backgrounds, ranging from sort of pure fluid dynamics through to really practical application of ventilation in buildings. So we're quite a diverse team, and some of these people will be speaking today and will introduce themselves to you later. So why we've created this network? So the premise of the network is that we are exposed routinely to air pollutants, both the indoor environment, the outdoor environment. These may, in some cases, be sufficient to cause health harms. But the premise of our network is that without understanding the fluid dynamics, you can't properly understand the exposures to air quality. So we have to understand the air flows into buildings and within buildings to be able to quantify and mitigate those poor air qualities. And the idea is to think about how we can link between the sources and exposure and use this knowledge of airflow to interpret what we might measure in these environments and interpret then what it might mean in terms of health risks to people. And it sounds simple on the face of it, but it isn't in the slightest, because the physics, and many of you will know this very well, but the physics of both outdoor and indoor flows and the connection between them is very challenging. So we cannot just simply model a building, model rooms within a building and say it's got a fully mixed airflow in there. There's a lot more to it than that. And if we want to understand people's exposures, we need to be able to think about where what the flows are in the urban environment, what the flows are in the indoor environment, and how these interact together. And they are complex. They operate in different time scales, in different length scales, different types of turbulence, and they will both carry different pollutants. So the outdoor air will have a different set of pollutants to the indoor air, and they will exchange between them. We also are very conscious that although this is driven from an air quality perspective, there are a whole raft of other factors that must be considered in there. So we can't possibly think about how we ventilate buildings better just on an air quality perspective. We have to think too about the energy aspect of that, including the wider picture around climate change. We have to think about how people's thermal comfort is impacted. We have to think about noise, acoustics, light, and we have to think about the air quality as well in here. And I think one of the other big drivers in this is the fact that at the moment ventilation of buildings is predominantly driven on a comfort and energy perspective, and isn't really set or defined based on a health perspective, and also doesn't consider how people behave in those environments very well and how they interact with that ventilation. We also design the building ventilation within a building largely disconnected to the city. So we might think about what is the outdoor pollution when we're designing a building, but we don't go beyond that usually. We don't think about how the airflow in the city or the urban space affects the indoor space and vice versa. And that means that we've ended up with a huge legacy infrastructure. It's changed over time, and in many cases it's not really fit for purpose, because as usages change, we've exposed people very differently to pollutants. I think although today, and this network is not about COVID, I think it would be wrong for us to not acknowledge where we are. And COVID has changed perspectives, and from the perspective of this network, has changed it in a good way, if there's ever a good thing you can say about COVID. I think we've got more people talking about ventilation than we've ever seen before. It's gone from being something that most people don't even consider to being a really hot topic, and lots more people are aware of its impact. There's now widespread awareness that buildings are poorly ventilated, but we don't have the data to understand that. We've realised that there's a big lack of public knowledge and policy understanding of ventilation. It's definitely far from as simple as let's specify a ventilation rate and everything will be okay. And then we've recognised that there are some short-term conflicts at the moment between if we want to increase ventilation rates, whether you can actually do it, but in some environments you just draw in more pollution, or you increase the energy use, or reduce the thermal comfort. So we need both long-term and short-term solutions. We need some things we can do very quickly, but we also need to think about how we can develop our infrastructure in the longer term to be more healthy and resilient. And some of that is thinking about low energy heating that might go alongside ventilation, and thinking about how we can impact on outdoor air to enable better ventilation to the buildings. So coming back to the Breathing City network, we are a network, so we will do original research, but it's a relatively small part of it because we don't have sufficient funding to do all of that. But the idea is to build the frameworks and to develop the partnerships to be able to drive a big research program forward. And that the objective around the whole network is to produce a health evidence framework for how we can ventilate buildings and design and implement ventilation and air flows in buildings and cities better. We've divided it into 3 themes. Theme 1 focuses on the coupled flows, theme 2 on ventilation design, and theme 3 on the regulation side of it. And we deliberately want to include all of these different factors and constraints, which you can see is going to make it incredibly complex. So the objectives of the whole network are about bringing people together as a network, and we want to use that to scope this framework, think about how we can develop this integration of health evidence with airflow design. We want to initiate the new research that needs to be done to deliver this. We want to make sure we build partnerships within and between academia and with industry, with policymakers, with other third parties, and with user engagement. And we want to really think through all the route from how do we take the underpinning research through into policy. Just a very brief introduction to the themes. So the first theme focuses on coupled indoor and outdoor environments, which is led by Malcolm Cook and Martin van Ruyck, and they will talk to you more about this later on. But this focuses very much on the models and techniques that we can use to look at how we integrate the flows in these 2 settings, and thinking about the technical requirements there, the data sets we can use, how we can characterize some of the complexities like human behavior, how we can look at different settings for particular vulnerable groups, and where there might be opportunities from technology. The second theme focuses much more on the ventilation design itself, and is led by Henry Burridge and Abigail Hathaway. So this is about thinking what do we mean by good ventilation for health? What's the evidence base for this? How can we specify ventilation? How do we have how do the airflows that we experience indoors and outdoors result in changes and uncertainties in the occupant exposure? What does this mean for how we design different ventilation strategies? And then what does that mean for the requirements both now and in the future? And how will that shift the research and the innovations that's needed to deliver this? And finally, the third theme focuses on taking Breathing City into practice, led by Professor Tim Sharp. And here we're thinking about how we engage with policy and users to understand the policy and practical implications of changing ventilation. So it's no good coming up with a great idea if actually it can't be delivered in practice. So we need to make sure we've got one eye on that practice end of it. Thinking through, actually this is driven by some real challenges, because we've got policy and regulation are in different departments, different agencies. It's not a single place. We've got to deal with both the indoor and the outdoor and the connection between the 2. So this theme will generally focus around setting up groups and workshops to identify those areas of influence, areas of expertise, gaps in the knowledge, and then thinking how we can carry some of the ideas through into strategies at a regional level, at a national level, into health strategies and into building ventilation type strategies. So the network itself will have an evolving programme of activities. It runs over a 3-year period, and it's got basically 2 major strands. One is around workshops and engagement. So the idea is to bring people together there to share ideas, to define the key concepts, to build the teams, and to take that research through into practice and policy. Obviously, we're in the world we're in now makes this a little more challenging. So our original plans will have to shift. We might end up with a more frequent number of smaller workshops online rather than the sort of envisaged larger scale 2-day workshops that we'd planned. But you know, that's one of the primary goals of this, and a way to engage across different people within this community of researchers and practitioners. Alongside those, we have funding to support some pilot research activities. Some of these are defined already and will be led by an investigator team and partners. Others are open, and we will be putting calls out in the future around very small CCON funding to support new ideas. But in the early stages, we're looking at how we can bring together some of the modelling techniques and test them, how we can use where we will need to do some systematic review to understand the evidence base, some community science facing activities, and as you'll hear a little bit about later, setting up an open repository for air quality data sets. So today I'm really pleased that we've got a packed schedule with some really great speakers. This morning we're going to focus on some of those underlying challenges and the aspects that are going to influence where this network goes over the next 3 years, and particularly focus around air quality challenges and some of the policy challenges, including where COVID has led us to. This afternoon, we're going to focus more on the practical and think about how we can shape this Breathing City approach with some breakout sessions to understand your thoughts and ideas. And then we will finish up with a panel discussion at the end of today, where we will think about some of the key issues that are going to influence where this network goes. So that's my introduction. I've kept it quite brief. Just to say, you know, please do follow us on Twitter, and these are our contact details. So I'm now going to hand over to our guest speakers, and I'm very pleased that our first speaker that we have this morning is Professor Sir Stephen Holgate. He's Professor of Immunopharmacology at the University of Southampton, has a very significant background in working on lung disease, including asthma and COPD. And he's also one of the clean air champions within the clean air programme. So thank you, Stephen, for joining us today. And Stephen's going to talk a bit about the clean air programme and some of the health challenges associated with poor air quality. So over to you, Stephen.
Thank you, Cath, very much, and good morning, everybody. And thank you very much indeed for inviting me to talk to you this morning. I thought probably best to try and provide a framework within which this network has been established, and to outline some of the broader challenges that we're faced with, because obviously this initiative is part of a number of initiatives to try and clean up the air, both outside and inside buildings. So I'm absolutely delighted that this particular network is being funded, and you are now moving off into this exciting new world of interaction together. Well, let me just start by explaining a little bit about the Strategic Priorities Fund. This is a large amount of money, £830 million, that was given by government to the UKRI to try and tackle some of the difficult societal problems that we currently have, but with a very strong view that there has to be some form of industry and financial gain for the country, as well as a social and health gain. So this is not like the regular grants that we apply for. This has got some drivers built into it that are all about the health and wealth of the country, as well as research. So the idea really is to develop this interdisciplinary, multidisciplinary and interdisciplinary research, and utilize the research to come up with some new ideas about doing things that have become intractable over time. And air pollution, of course, is one of those areas. We need to make sure that the investment that they've given links up with some of the research priorities within government, and this exactly is the case for air pollution, so that's absolutely fine. And we've got to make sure that the system, that whatever's put in place, responds to the priorities and opportunities, which this network, of course, is one. So the air pollution one is obviously around the health problems we currently have linked to both outdoor and indoor air pollution. I'll explain a little bit more about the air pollution SPF in a second, but of course it's on the background of the fact that air pollution is the #1 across the world and in this country environmental cause of adverse health. And I mean, obviously excluding virus infection and infectious disease generally here, but it is a very high priority indeed for the UK government to do something about this. And obviously it's all about really a whole range of different activities that, as Cath mentioned, have kind of grown up over time without giving careful attention to what was actually happening in terms of emissions that were coming from usually the internal combustion engine, but also emissions from industry and from farming, which are creating an adverse health problem for people, particularly those who are vulnerable, as you correctly pointed out, Cathy. So what we want really is innovative solutions. And I suppose in a way these workshops that you're discussing today are all about trying to look at what that innovation might look like and what sort of connections need to be made. So let me just start off really by saying that air pollution is an intractable or wicked problem. It's largely kind of grown from the times in the early 50s when, of course, we all thought air pollution was beaten with the Clean Air Act of 1956. But what's happened since then is that society has changed so much that people are exposed to a different array of pollutants. And this is one of several recent studies. This one was conducted on 61 million people in the United States on the Medicare system. And what it basically shows is that for both particulates on the left and for gases on the right, and I've just put two examples here, there is no safe level of air pollution. In other words, those lines are passing through one. It's a log scale on the left-hand side. So in other words, there are going to be some people who are susceptible to air pollution, even at levels lower than the current limit values that we're operating under at the present time. And in that study, as well as studies here in the UK and elsewhere around the world, it seems that not only are there adverse health effects at levels below limit values, but also there are vulnerable groups, particularly those in racial minorities and the disenfranchised, those people with low incomes. And the same is true everywhere in the world. So we're not just dealing here with an environmental issue, we're also dealing with a social injustice issue if one's thinking that the most vulnerable people are exposed to the highest levels of pollutants in terms of their adverse health. I'd also like to just draw attention that air pollution isn't just about statistics and limit values. I was involved before Christmas in presenting evidence to this case, which is a very sad story about Ella Kissy Deborah, a 9-year-old girl who died of asthma in 2013 after 27 hospital admissions over 2.5 years. And this is what the coroner said about it in his report on December the 16th. that he considered that air pollution made a material contribution to Ella's death, and the fact that NO2 and PM were in excess of World Health Organization guidelines suggested that the level of pollution she was exposed to, leading to her terrible disease and death, was contributory. And thirdly, that in his discretion, there was a failure to reduce the level of NO2, which contributed to her death. And that obviously has tremendous implications in terms of limit values that we often talk about. And finally, in his summing up of the inquest, we can see here that there are 3 points that he makes. That this is a very high profile case because it's the first time in the world that air pollution has been put on a death certificate as a cause of human, of a death of a child, let alone death of anybody. So the implications of this are very considerable. And so in a way, the work that you're about to embark on is really very, very poignant for individuals whose disease is being exacerbated and made worse by air pollution. So this is the SPF, the Clean Air Solutions SPF. There are 2 waves, £20.5 million in wave 1, dealing with current issues, and £22 million in wave 2, of which the networks are part of. And of course, the wave 1 is about trying to improve things as they currently are, whereas what you're involved in wave 2 is addressing this indoor-outdoor continuum of air pollution exposure. And already there are issues that I think your network is going to be able to be very helpful in. Firstly, we've identified communication barriers between the physical, biological, and social scientists. And this needs to be broken down if we're going to get efficient transfer of knowledge to those that can make a difference. There's a failure of engagement by the medical community as a whole to take ownership of this, that they did, of course, with passive cigarette smoking, but not air pollution yet, so there's work to be done there. There's confusion in the public, although public understanding is increasing. There's still a lot of confusion out there as to what they can do as individuals to help the situation. And there's very little positive motivation to generate behavior change. A lot of the air pollution discourse is put in negative terms. And then, of course, there's pushback from industry, meaning that obviously there's concern about employment if one cleans up the air and reduces vehicle access to certain parts of cities, etc., etc. So there are some quite big roadblocks to get over here, which I'm hopeful your network is obviously going to play into very effectively. So this is the 5 points of the Clean Air Solutions and Analysis grant program. A solution-based output with a cleaner and healthier society. Secondly, the generation of this interdisciplinary and multidisciplinary research Cath mentioned. Facing the challenges, which are complex, again, Cath mentioned this, and trying to get new ways of dealing with it. Trying to influence policy, and obviously we have the Environment Bill coming up later this month that will be heard in Parliament. And finally, we don't want perverse consequences of any actions that take place. So wave 1, 5 grants have been awarded across the country. I've just listed them here. You can have a look at the titles. 3 have been awarded through the Met Office and the National Physical Laboratory. And in addition, there are the Clean Air Champions, which I am one. I'll introduce my colleagues here. There's Jenny Baverstock and Gary Fuller. Jenny's in Southampton with me, and Gary's at Imperial College. And our role really is to try and help you catalyze the interactions you want to generate. And can I draw your attention to the website that we started at the bottom of this slide, where you can see an update of where the whole program is going, in addition to the one that you're involved with. So the Clean Air Champions are very similar to your own, really, in terms of what we've been asked to do, which is to map the competences and dimensions, unify researchers and stakeholders, uncover challenges, and create new ideas and then translate these into practical interventions and get those then to travel through to the public communication and professional communication channels. So in a way, it's very similar to what your network, I think, is going to try and do. And as Cath mentioned, I mean, the indoor-outdoor interface is obviously critical here. And I've just put a couple of slides up to show on the left and in the middle the fluctuations that occur across 24 hours as people do different things. And therefore, their exposure to air pollution is not homogeneous, either in amount or in content. And in the middle there, you can see that the indoor air quality in this particular building and the outdoor air quality were fairly close to each other, suggesting that outdoor, as Cath mentioned, is an important component. And on the right-hand side, I wanted to really highlight that it is the young people, the indoor generation, that are being exposed more to these indoor pollutants now than was the case, say, 40 or 50 years ago, when indoor air pollution wasn't such a problem. So in terms of wave 2, the networks we've just heard about, you're one of them, the interdisciplinary research and the consortia, which are going to be announced before too long, which are research funding, business-led innovation, and 3 or 4 projects are going to be supported from business using Research Innovate UK. And finally, the coordination and integration, obviously, of what the interaction of all these levels are, which of course is what your network's all about. So you're one of 6 networks, but there's also a metrology network at the NPL, and Breathing City is a particularly exciting one, which we're absolutely delighted to hear about. The consortia, the shortlisting has been completed, the grants are being written now, there will be a competition, and there will be 3 or 4 large grants awarded along some of the principles that are shown in this slide to make sure that we cover areas where research is missing and we desperately need new information, including biological materials, toxicology, behaviors and practices, and obviously interventions in the built environment, which is what your network's all about. So I wish you and all of your colleagues great success in this wonderful network that you've started. Breathing City, Future Urban Ventilation Network, has a great chance of making a big impact on this scene, and it could not come at a better time. Thank you very much indeed.
Thank you very much for that fantastic intro, Stephen. And I can ask if anybody has any questions for Stephen, if you would like to post them in the chat. We do have a few minutes for questions. Perhaps I could just start off, Stephen, and ask, obviously COVID has changed an awful lot, and mostly not good, but obviously there are some, potential benefits, shall we say. Yeah. Has that featured in the thinking around the Clean Air Programme and how that goes forward now?
Oh, very much so, Cath. And I think what it has done, and I think you touched on it actually in your introduction, is shine a light on the indoor environment, really, and an area of air quality which has really never had the attention that it probably deserved, even going back over many years. So obviously much of the transmission, as you'll know yourself because you've made a big contribution to this field, much of the transmission occurs in indoor spaces. So we've got to understand indoor spaces much more than we have previously, and obviously things are changing quite dramatically on that front at the current time. But also the relationship between COVID and air pollution, and there's been some interesting debate in the literature about that relationship, whether air pollution can actually make the disease worse, whether the virus can be carried on a particle or not. I think probably not, but at least there has been some rudimentary evidence that bits of virus are carried on particles. So this has made a big difference, yes.
Yeah, thank you for that. Does anyone else have any questions that would like to ask to Stephen this morning? Okay, on that basis, your presentation was clearly so clear, Stephen. That oh, we've got one in here. Okay, so a question which from Kate de Selencourt, which says, you talk about innovation. Does that apply to innovation in framing as well as technologies?
Yes,
And there are a
absolutely.
lot of good solutions that currently aren't being used.
Yeah, I mean, absolutely. And I think, you know, everybody often thinks of innovation in terms of gizmos and things and industry and whatever. But absolutely, innovation actually extends beyond that. In the UKRI's definition of innovation does involve enterprise that moves outside of the business domain. So what you're doing, which is creating connectivity, is innovation in a ways, because if it leads to behavior change, it's obviously going to produce some fantastic benefits.
Can I ask as well, Stephen, you touched on behaviour a couple of times in your talk, and I think that's perhaps one that I don't know that we've actually nailed properly in here, but I think that's one that gets overlooked a lot of times. Do you think we need to do more active engagement into social sciences to enable this?
I do, Kath. I think that's part of the problem. The narrative around air pollution is largely negative, and this is what the public perceive. Whereas if you look at what's happened in climate change, which you mentioned also, they've turned the narrative into a positive narrative, you know, one where people gain, they can see the individual gains as well as societal gains. So we've got to change the discourse to show people if we do clean up the air inside and out, we're going to improve people's lives. And somehow that hasn't happened. So we need help from the social science community to enable that discourse to be constructed.
And there's another question come into the chat from Kayla, who's asked us, have the Clean Air Programme and Champions considered the benefits of research co-design with the effective public, which could address systemic barriers to knowledge exchange and behavioural transformations?
Well, that's another great question. And we are, in fact, entering into some discussions with the National Institute for Health Research, Louise Woods, who, as you know, insists upon public participation in the design of research as well as its delivery. So we are about to have some discussions about how we get the health side of all of this moving, because what we've got is the research councils, which in terms of health, the Medical Research Council and probably the BBSRC to some extent, but they're very mechanistically focused. But what we really need is the health science to get the behavior change we've just been talking about into practice, and patient and public involvement is going to be absolutely crucial to that. Otherwise, we're going to get nowhere with this.
That's fantastic. Thank you ever so much, Stephen. Oh, you've got one more question in here, which is, in the very sad case of Ella, should the government now be adopting the WHO guidelines? And how is it possible her mother was completely unaware of the links between air pollution and health? Yeah,
well, both of those questions are the one that I think in about 5 or 6 days' time, Philip Barlow, the assistant coroner, is going to make pronouncements on, because they are absolutely central. Firstly, WHO guidelines are health-driven guidelines. They're not guidelines manipulated by other inputs. And active discussions are going on right now as to whether or not we can agree legally binding limit values for PM 2.5 that are going to conform with WHO. So I'm just keeping my fingers crossed that we can, and hopefully Rosamond Kissy Deborah fight for her daughter won't be in vain having done that. And secondly, and I think this is a really important point, the health and medical profession have not taken ownership of air pollution. So when little Ella was admitted to the 6 hospitals in London and went onto intensive care units, etc., never once was air pollution ever mentioned as a possible cause of her problem. Yet she lived a whole of her life 15 meters from the South Circular motorway. And that's, again, a big issue. So yes, you know, it's time things changed.
Fantastic. Thank you ever so much, Stephen, for such great input this morning. Yeah, I think we're going to move on now to our second speaker, which is, I'm very pleased to welcome Dr. Sani Dimitroulopoulou, who's a Principal Environmental Public Health Scientist from Public Health England. Sani has done a tremendous amount of work looking at indoor air pollution, which, as many of you know, has had far less exposure than outdoor air pollution. But I'm very pleased to have Sani here to talk about some of the focus of her work and why indoor air quality matters. So over to you, Sani, if you'd like to share.
Thank you very much, Cath. Let me just share my screen first. Can you see it?
Yes, if you could, can you get into presentation mode?
Yeah, I'm trying to do that. Great.
Brilliant. Yeah.
Okay, thank you very much. So first of all, thank you very much, Cath, for your kind invitation to make this presentation on indoor air quality and health impacts. And also my very best wishes for a successful work within your network, because it's really exciting to see what you plan to do here. So I would like to start my presentation by reminding you of the factors that affect indoor air quality. I mean, most of you may be aware of those, but just a kind reminder. And it is, first of all, the ambient air with emissions from transport and industrial activities. Then urban planning, which defines the urban form, can have an impact on indoor air quality because it defines the dispersion processes in urban areas, and in that way the concentrations of the pollutants on the building facades, the pollutants that eventually penetrate into the indoor environment. Now, the ingress of the outdoor air pollution indoors depends on the building design, location, and characteristics, and certainly the maintenance of the building. And studies show that approximately half of the outdoor nitrogen dioxide and PM2.5 concentrations can be found indoors. So ventilation is now crucial and central in the whole process for improving and maintaining good indoor air quality. However, it's not the panacea for indoor air quality issues, because the very first that it is required is the control of emissions. Emissions from building and construction materials, furnishing and consumer products, but also emissions that are generated from occupant activities such as cooking, smoking, wood burning, or drying clothes indoors. And in the indoor environment, I would like to use now this well-known slide, the slide that has been used before and generated by the VOC report and was used on the outdoor air, and the VOCs report on indoor air quality published last year. So this shows very well the sources and the types of indoor air pollution that can be found in homes. So the common indoor chemicals in the indoor environment, apart from radon, are products of combustion. And this can be the carbon monoxide, nitrogen dioxide, particulate matter, and also polycyclic aromatic hydrocarbons. We can also find volatile and semi-volatile organic compounds, including formaldehyde, which are emitted from household products, furnishing and building materials. And finally, last but not least, we can have biological contamination. So going to the side now of the impact of indoor air quality on health, I would like to start with the evidence produced by NICE. NICE is the National Institute for Health and Care Excellence, and the guidelines that were developed and published in January last year. So these are guidelines on indoor air quality at home, and the PHE, Public Health England, has co-badged these guidelines. So within this framework, NICE carried out evidence reviews. They looked at studies that examined the association between individuals and building characteristics and health outcomes, but also studies that examined the association between sources of pollutants and health outcomes and exposure levels to the various pollutants and health outcomes. And by interpreting the evidence, it was concluded that nitrogen dioxide, volatile organic compounds, particulate matter, but also polycyclic aromatic hydrocarbons and biological agents are sometimes associated with respiratory, cardiovascular, and neurological systems. Now, the certainty of this evidence was mixed, but that was largely due to the different contexts in each study. For example, there were differences in populations or age, but also different ways of reporting on the same outcome. For example, for respiratory symptoms, they considered coughing, sneezing, wheezing, etc., a list actually of different ways. The second work that I would like to mention that focused also on the health impacts of exposure to air pollution is by WHO. It is an ongoing project which is expected to finish this year. We have already 2 outputs of this work, which are shown actually on the slide and can be downloaded from the WHO Europe website. So this work aims to develop a tool to assess the cumulative risk from combined exposure to indoor chemicals in schools. And they carried out the literature reviews. There were toxicologists involved in this study, European actually, and high level with a lot of expertise in the area. And they concluded that exposure to indoor chemicals may be associated with the respiratory system, nervous system, also the cardiovascular system, but also may be associated with carcinogenicity and respiratory irritation. At that point, I would like also to mention the report by RCPCH, the Royal College of Pediatrics and Child Health, and RCP, Royal College of Physicians, which also was published in January last year. This report was focused on indoor air quality, and it is called the Inside Story, the health effects of indoor air quality on children and young people. It was a review, a research project that looked at the evidence in order to report the health effects from exposure to indoor air pollution. So a project working group carried out the systematic literature review and undertook also the writing of this report. And it was found that exposure to indoor air pollution can affect children at the various stages of their life. So at birth and infancy can lead to respiratory problems or low birth weight and preterm birth. At the preschool age, again respiratory problems, but also eczema and atopic dermatitis, which is as a result of the dermal exposure. But also at the school age, apart from the above, we can also have reduced cognitive performance and difficulty in sleeping. I would like also at that point to mention our work at Public Health England, because apart from our contribution to the above projects by NICE, WHO and RCPCH, we also looked over the last couple of years at the health effects from the exposure to various to indoor air pollution for various population groups, considering also the socioeconomic status, but also we looked at the impact of interventions. So at that point, I would like briefly to mention the work that we did on the development for the very first time in the UK of indoor air quality guidelines for selected VOCs. We know that until recently, there were no guidelines for individual VOCs in the approved document F, at least in the previous version, because it's now updated. It is actually, it's going to be updated. It was considered that the exposure to to the total volatile organic compounds should not exceed the 300 micrograms per cubic meter concentration averaged over an 8-hour period. However, TVOC as a measure reveals very little regarding the nature of the individual compounds, their concentrations, and their possible toxicity to humans. So we carried out a comprehensive literature review in order to identify, first of all, the occurrence of VOCs in the indoor residential and also public buildings in the UK and Europe. We looked at their concentrations, sources, toxicity, and health impacts. And we considered VOCs which were emitted from construction products and building materials in order to cover the construction phase, but also from consumer products in order to cover the post-occupancy phase. And we published the proposed indoor air quality guidelines that can be considered in the indoor environment. It's a list of, these are for 11 VOCs in the next website. We propose limit values for the short-term and long-term exposure. We provide the information for the source document, for the reasoning of the choice of these guidelines, and also we report the potential health impacts from exposure to these compounds. And of course, this can be downloaded from the gov.uk website, or you can find more information in the published paper. Now, regarding the exposure to air pollution from indoor solid fuel combustion, we carried out a systematic review and also meta-analysis of epidemiological studies conducted in Europe, North America, Australia, and New Zealand in order to evaluate the association between indoor solid fuel combustion exposure and respiratory outcomes in children in developed countries. And the results show that there is currently little evidence linking exposure to indoor solid fuel with asthma and link them with asthma and other respiratory diseases in children. However, this doesn't mean that exposure is not having any health effects, but it's rather that there is no currently very strong scientific evidence that shows that, and that more work, further research is needed in a systematic way in order to establish if there is a link here. So furthermore, we looked at the impact of the exposure in relation with lung cancer, and also in this case, the evidence is still limited because there are very few studies that have evaluated such an association. Furthermore, in terms of interventions, we carried out some work within the framework of a European funded project, the Quasimodo project. So we looked at the impact of the home air purifiers in the concentrations, in the PM2.5 concentrations in the indoor environment, and the impact also on health. So our review shows that we had identified actually 17 studies considering both the indoor environment and looking at the health impacts. So the figure here, in this figure here, you can see that wherever actually a home air purifier was not used, the concentrations were marked in blue, but where actually a home air purifier was used, the concentrations were reduced. This is what is presented in red here. And we had a reduction of between 26 and 92%. Now, looking on the health side, our review showed that there is currently not enough evidence to confirm health benefits, but the problem here was that there were very few properly designed studies. So in our publication, we make a recommendation about the proper design of the studies that can help us to conclude on the health side. But in this case, we can only say that since there is strong evidence that exposure to particulate pollution is harmful to health, we expect actually that we have positive health impacts in terms of when home air purifiers are applied and used in the home environment. And finishing with finishing my work, the work actually on the intervention side, I can mention here the guidelines again by NICE, and this is the two-page visual summary that can be downloaded from the NICE website. Based on the outcome from the literature review, they proposed some actions for local authorities, some advice on reduced damp and condensation, also increasing ventilation and, further action to reduce emissions in the indoor environment. But also they provided advice for actions for healthcare professionals and also for the building industry, actions for architects, designers, builders, and developers. And although these guidelines were published before the pandemic, the behavioral interventions, which actually are addressed to local authorities about reducing damp and condensation and reducing the sources in the indoor environment, are very, very relevant also during the lockdown to all the house occupants who wish to improve the indoor air quality and maintain good indoor air quality in their homes. And at that point, before I finish, I would like to mention some of our new work at PHE, but also to our contribution to indoor air quality activities of other organizations and also government departments. First of all, within the NIHR HPRU is the Health Protection Research Unit, and specifically the Environmental Exposure and Health in collaboration with Imperial College. We develop a VOC and SVOC exposure modeling tool. PHE is leading this work. The second project I would like to mention is that on CO2, on carbon dioxide. There is a lot of discussion if it should be just an indicator for ventilation or if it should be considered as a pollutant that can have health impacts on individuals. We have carried out a literature review, and we're going actually to send for a peer review publication this work at the end of this month. So I do hope that if you wish to hear more about that in a future meeting, perhaps I can report the outcomes from this work. We have also the HEC report. The health report is the health effects of climate change report, which is led by PhD. And I'm leading the chapter on the impact of climate change on indoor environmental quality and health. This report is going to be published, hopefully, some chapters at least before the COP26 in November this year. And of course, we participate in the UKRI funded networks. In terms of our collaboration with other organizations, I have already mentioned the WHO project, but we also participate in the development of a new standard for non-domestic buildings on health and well-being performance, which is led, this is actually referred to Wales, and it is led by a Welsh organization. And on the government side, we contribute to the MHLG work, MHLG planning work on the revision of HHSRS, which is the Housing Health and Safety Rating System. It is a 2-year project which has just started. And I contribute together with my colleague from the housing sector. I contribute also from the PhD side on this project. And last but not least, I would like to mention the DEFRA's work, the work of the air quality and expert groups, the report that it is planned this year on VOCs and also particulate matter. So thank you very much for your attention. And as usually, my invitation that we should work together in order to reduce the exposure to indoor air pollution. Thank you again.
Many thanks, Sani. That was a really interesting presentation, and great to see so much work that PHE have led over the past few years in this area. As before, we've got, if people would like to post any questions to Sani, please put them in the chat and we can share them. I mean, you talked quite a bit about air quality guidelines. I mean, how easy is it to make these work in practice? Because I think it's one thing to say this is a good guideline, but in indoor air, it's very hard to deliver that in practice.
Absolutely, Cath. The point here is that we wanted really to prepare and propose these guidelines because we had realized that there is a huge gap in this area. We had seen that there were many consultants going to buildings, investigating actually and measuring the levels of VOCs in the indoor environment, and they were always comparing this value. They were doing long-term measurements and they were comparing this value, for example, for formaldehyde with the short-term guideline value of just one compound. So we thought that yes, something is missing there, but also there were individual VOCs that were measured and there was no indication and any measure for comparison with the health-based guideline values. So we believe that these guideline values, it's not really on the design side, but can help really for comparison purposes when measurements are made in the indoor environment.
Thank you. I've got some questions in the chat. So from James McGrath, he says, in the context of air purifiers during the review, were you able to identify if the air purifiers had a great impact on reducing the indoor or outdoor generated sources?
I think, I mean, what actually this review shows was that the levels of PM2.5 were reduced, and these were both of indoor and outdoor sources and were greatly reduced. Yeah. From 26 to 92%, which is amazing, really.
I imagine it's actually quite difficult to separate those two out.
Exactly, exactly. Yeah. When you're doing this kind of measurements, actually, it is really very difficult. Yeah.
And then a question from Sarah King, which asks, how have the requirements for increasing air tightness in building construction, which have emerged over the past 20 to 30 years, played into all of this issue?
Well, this is really a very good question. This is something that also can be addressed within your network. Certainly, it can have a great impact. It is, I mean, all these measures are also placed within the context of mitigation and adaptation measures for climate change. We have already addressed that in previous reports. We are going also to address that again in the new chapter that we're developing. But yes, certainly there is a great actually impact. And yeah,
I have another question on air purifiers here as well, from Archit. Is there any work ongoing looking at the rapidly growing market? Oh, hang on, sorry, my questions jumped. Is there any work looking at the rapidly growing market of air purifier technologies and the potential for some of these to actually have detrimental health effects? For example, some of the non-HEPA based purification technologies, and does this need better regulation?
Yeah, I mean, our work was carried out, finished actually back in 2019. We looked at the evidence at that time. We looked at what actually work was carried out up to that time. But as I said, because we found that it is actually the design of the study that can have a serious impact and can help us to identify some health effects on people, on the various population groups. I think that if there are actually new air purifiers and more advanced systems, these should be tested, and properly designed studies can help them to identify their impact on the various population groups. Please have a look actually in our publication, because we make recommendations over there how this should be done.
Thank you, Sani. And then one last question, which asks from Simran, what measures were most prominently utilised to quantify the health impact of the studies mentioned, and were self-reported measures taken into consideration when researching possible interventions?
Well, there were studies actually that were based on toxicological but also epidemiological evidence wherever that was possible. And generally any health assessment can be done, certainly started from the toxicological evidence, and this is how the existing work has been done up to now, both in the NICE guidelines but also in the PHC guidelines. We looked at the standards and the health-based guideline values based on the toxicological evidence that were behind that.
Great, thank you. I've got actually one last question, because you touched on the exposures in the home and the fact that more people are working at home. And I did wonder whether we've got any evidence, or whether we're collecting any evidence about changes in people's exposures over the past 10 months.
That's a very good question, Cath.
Now might be even more important than the first lockdown period, when we were all outdoors a lot more.
I wouldn't agree more with you, Cath. And certainly more work is needed right now on the monitoring side, really, to give us this information, to identify the new levels as a result of spending more time indoors, cooking, longer hours. This is what we're doing perhaps as housewives or, homemakers, working a lot in our offices and using printers, some things that we couldn't really done before, and certainly spending more time physically in the indoor environment. So yes, please, more measurements here.
Yes, definitely. If anyone is doing this, please do it, even if it's just survey work at the moment. I think it's absolutely essential. And on that note, you mentioned we spend more time. I think now is time for a break.
Great.
So we will have a short 10-minute break. Thank you ever so much to Sani and to Stephen for the first two talks today, which I think have really started to set the scene for the challenges that are going to underpin this network. So I'm very pleased to welcome our third speaker of the day along to join our this morning's network meeting. So our next speaker is Professor Paul Monks. Paul is a professor of atmospheric chemistry at the University of Leicester, and he's also recently taken up the role of Chief Scientific Advisor for the Department of Business, Energy and Industrial Strategy. So very pleased to have you with us today, Paul, to talk about COVID-19 and net zero and some of the challenges and opportunities for the built and urban environment in this sense. Whenever you're ready, off you go.
Okay, Cath, can you see my screen?
Yes, I can.
Okay, great, wonderful. Thank you very much, everybody, and welcome this morning. So I see you've had the inimitable Professor Holgate this morning, so who's done the air quality routine. So I get to talk a little bit about the new portfolio. As Cath says, I've been the Chief Scientific Advisor at BEIS now for 4 or 5 months. I want to pick up some of the things that I've learned there, which I think are relevant for this consortium to think about. I'm going to talk about COVID, net zero, challenges and opportunities for the built and urban environment. I guess one of the things I reflect from my early experiences in BEIS is I kind of knew about net zero, but I hadn't kind of realized how pervasive and important it really is going to be in the coming period of time. The UK government was one of the first in the world, actually probably was the first in the world, to legislate in 2008 to commit to going net zero by 2050, which is a 100% reduction in our greenhouse gas emissions compared to our 1990 levels. And that's embodied in something called the Climate Change Act, which gives us these legally binding targets. And we're coming up for setting the 6th carbon budget, which kind of covers the period 2034-ish on average during the early part of this year. It's part of our link to the Paris Agreement in terms of nationally determined contributions. And there's no doubt, if you look at the carbon budget, it's going to be an incredibly difficult thing to achieve, incredibly worthwhile, but incredibly difficult thing to achieve, and something that we're going to need to pick up. And I'm going to come to really the role of buildings in that, and ventilation therefore. Recently, just in case you weren't aware, the government produced a national infrastructure strategy, and in that it describes how the government will, through infrastructure, boost growth and productivity. Also, in that national infrastructure strategy, embrace the 2050 net zero target as well. So in a way, infrastructure is an important part of the future. Actually, the discussion in Whitehall at the moment is it's going to be one of the big pillars of economic recovery. So it's quite relevant to buildings, the built environment and the urban environment, which are going to be very much in the fore as part of the green economic revolution, but also the building back better post the COVID thing. I'm sorry for a bit of government bingo there, but yeah, that does kind of get the direction of travel over. Just in November, early December, the Prime Minister announced the 10-point plan for the green industrial revolution, supporting green jobs, accelerating a path to net zero. Number 7 on that list absolutely is greener buildings around that, and sits at the heart of the net zero challenge. So the point I was making earlier, I think, is you can really look at some of the detail on this, and though this government schemes, I think it kind of gives you an idea of something I said earlier. Really, to achieve net zero by 2050, we're going to need this economy-wide transformation, embracing transport, business and industry, power, land use and resources, green solutions, alongside some of the questions around particularly domestic buildings and the like, as well as new technologies potentially for greenhouse gas removal. And it's worth noting that 15% of the emissions in the current system actually come from buildings and the like. So in a way, when we're thinking about the future, it's going to be what should the future of our buildings look like, and how does that fit in the net zero? How does that fit in the net zero context, as well as many of the other contexts? I think also, and the next slide is supposed to kind of look at this. This is not an easy space to understand. This is a systems level map, or it's a systems level map that you can draw of the energy system and how that links to some of its usage sectors here. So over there you've got the sectors of electricity, gas and oil, moving to the way that they're used in buildings, industry and commerce, land, water and air management and transport. You can see some very complex systems, system interlinkages there, and there's going to be some real system changes over there. We're going to electrify the economy by 2050 in order to meet those net zero targets, which is going to mean a doubling of our electricity demand. And then the question, of course, is we want to produce that electricity in a sustainable way. So in a way, the heat network and the way that homes are powered is going to change in some senses. And you can see there some of the links in terms of the electrification, decarbonisation that is going to drive forward. And interestingly, coming up in the next period of time, the government will release a home decarbonisation strategy, a heating and cooling strategy for homes. So that's going to be released quite imminently. So really, it's to the fore of how we think about this is in this, and you can see that it sits, and these transitions sit between the global energy transition, the global economic transition, consumer behaviour and change, as well as systems and finance funding that drives these change, and buildings sit at a nexus of many of these key changes that are going to be part of this system. I think it's worth, when we talk about infrastructure, and I've taken this from the Centre for Digital Build Britain, it's worth remembering that we are talking about a system of systems. So we talk about the urban environment, we're talking about and buildings, we're talking about in some senses the economic infrastructure, the social infrastructure, and the natural environment, and the way that they're linked together. And that's what gives us, in some sense, the built environment that we're working in. And for me, that's incredibly important, that you cannot treat any of these things as independent. I think, I'm challenged constantly as a physical scientist to remember that, the social infrastructure and the way that people use that infrastructure is as important in some senses as the way that we build the infrastructure ourselves. And economics can drive, interesting incentives through that. I mean, I was taken by a report that I read quite recently from the Centre for Digital Build Britain that said, actually, if you are to have a flourishing system, if we are to re-envision the infrastructure as a platform for human flourishing, you've got to have a vision for infrastructure that is people-focused, which recognizes that social, economic, and environmental outcome that determines the quality of people's life. But you've also got to do that in a systems way, which recognizes that infrastructure is a complex, interconnected system or systems that must deliver continuous service to society. So that's the challenge that I would kind of give you, in some senses, to think about, is as you think about some of the physical aspects of that, remember that it must be people focused, and remember that you are dealing with a systems of systems type approach, as I've just shown you in the net zero realm and the way that net zero interacts with this. I think there is a great deal of challenge in the way to move that forward. I said I'd talk a little bit about COVID-19 and net zero, and I think it does provide us with a whole set of questions about our direction of travel. And on one level, very simply here, of course, you can say, well, what COVID-19 has said is that ventilation has come to the fore as a key element of the way that we think of, if I could call it, healthy households in that sort of sense. Yet actually, if we think about the journey to a net zero home, that net zero home is more and more much more heat efficient in the way that we use it, and actually provides a real challenge around, for example, ventilation. So where ventilation is great for providing good air circulation and in this case reducing the COVID-19 virus, the future net zero home, which will be much more highly energy efficient and the like, with heat recovery systems and much more highly insulated, in a way provides us with a challenge for that. And I think one of the things this consortium obviously will be looking at is thinking about some of those challenges. So if I can lay the net zero challenge in central to some of your thinking, I think that would be a good thing to get from this talk. I want to just take a transition and talk a little bit about something else which kind of intersects COVID, net zero, and also thinking a little bit about the future, which comes out of the BEIS departmental portfolio. And that's the role of digital twins. And I do feel at the moment, if you can't go to an academic talk without somebody talking about digital twins. But it strikes me in some senses that actually in the area of the urban and built infrastructure, digital twins are actually at a level which is much more advanced and can provide much more insights than maybe some of the other areas that people are talking about. And many of you know what a digital twin is, but I've just put down the definition here. And I think that it's that one on the top right hand corner there, that actually digital twin is not a data model. It's actually a relational interaction that provides potential challenge of producing those digital twins, but also the real power potentially that we can get from those with that simulations that gives us a degree of fidelity. If we take that to the built world, there's been a long history of BIMs, building information models, and in the way that architects and the like have built have designed buildings, and you can think of a building information model in the digital world as the basis of that gives you the concept design and the design and actually for construction. But if we are to deal with a building all the way through its operation and the way that it functions in reality, then digital twins become incredibly important. That merging of the digital world with the physical world in the urban and built environment becomes a very, very powerful tool where we can use things like machine learning, predictive maintenance, analytics to really understand how buildings function and optimize that function, which is going to be very incredibly important to meet challenges like net zero, but also incredibly important to think about the challenge for the future urban environment and the way that it functions. And that drives it back to one of the challenges in the digital world, the digital twin, and is actually getting that human interaction that I talked about earlier, that social interaction, if you will. And actually digital twins, looking at the way that buildings perform in reality, is a good way of collecting that sort of data and that understanding and incorporating it into there. So I think a real genuine challenge for the urban infrastructure. So at BEIS, we've been developing for a number of years building information modeling as part of the industrial strategy, and really using BIMs as a way of managing information through the whole life cycle of a built asset, from construction to decommissioning, through that model. And really it allows, where we started off was it really allows design and construction teams to communicate about these sort of things and look at levels that have been unseen before. And I think it does give that sort of challenge. And just an example of the sort of things that have been done with these sort of BIMs to date. Here's the remodeling of Liverpool Street Station and Victoria Station in London, and you can see the complexity of the infrastructure that you're dealing with. You can just see the power from the building and construction side in some senses, never mind trying to understand, as we put these into digital twins, how they function. And I think that drives us in some senses to the end point of all this, which is that we want our urban infrastructure to be a smart city. We want it to be data driven, we want it to be sustainable, resilient and prosperous, and we want it to be user focused and flexible. And you can see all there the 6 elements of a smart city. And I think the challenge is to bring those together, to make them real, to make them realistic, and to make it more than jingoistic phrases, if you will. And think about how we can drive our data and our research to drive that sort of understanding. I'm very challenged at the moment by the way that the Internet of Things will interact with this sort of smart city as we instrument our cities and we use that sort of data, we instrument our buildings. Can we drive that sort of smartness? So by way of summary, I think there's a significant challenge for net zero. It's a pervasive challenge through everything that we do. It's particularly a pervasive challenge, I think, in the building sector, the urban environment sector, and I want to challenge you as an academic community to think about how you're going to address the challenges of net zero in your thinking in this consortium. I think there is a juxtaposition in the post-COVID world in things like ventilation between that and net zero, and I'm sure somebody will contradict me at the end, but that's the good part of scientific discourse in this. And I think that I pointed out that digital twins also will offer a multitude of possibilities in that built environment to merge that physical and digital together, which I think will be critical to something like the delivery of net zero. So thank you very much this morning for listening to me, and happy to take any questions at this stage.
Thank you, Paul, and for giving us that a really interesting and actually slightly different perspective on thinking about the challenges that we're going to be facing and the policy world that we're going to have to interact with as part of this. So we do have a number of questions that have been posted. So a question from Kate, which is regarding systems. Perhaps this is a challenge back to BEIS, and ask BEIS about how can we move away from some of the single measures of success, for example, carbon as a single measure of success, and centre the occupants in the building strategies. So how can we, how is progress in BEIS on valuing health outcomes being made in here too?
So I think that I wouldn't address this the whole of BEIS. I think this is the challenge, isn't it, of these policies that cross-cut multiple departments. And I think that net zero, right? Which I will bang on about forever, is not a Bayes thing. It's across government. It's across government, and I think we've got to look at. You're absolutely right, and I'm starting a project in Bayes at the moment for, well, what does success look like for net zero? How do you measure it? What are the metrics for it? And and I think your challenge is a good one. How do we do that in the built environment and not just take simple measures like reduction of carbon? I'm very aware of antagonisms in policy where you focus on one thing and all you do is you displace and create a problem in another area as well. So I think that I would look to some of the academic communities about how we can develop the sort of metrics that allow us to look at the understanding and the measures that we have, where we understand how building policies deliver health outcomes. Do we at the moment? If I said to the academic community, can we measure how building policies deliver health outcomes? I don't know what the community would say in terms of doing that. So I think the challenge is not just a government challenge, it's the community to support the government, develop and actually put the delivery metrics in for those sort of policies.
Thanks, Paul. And I think hopefully we will give you some metrics. There's a question here which says, from Stephen, how realistically do we square the circle between high levels of ventilation and net zero? Is it really possible to do heat recovery in a building with the window open?
So I think, again, I'd look at this consortium, is the challenge, isn't it? So how do we understand ventilation simply as opening the window? Or do we understand ventilation as the way that we can think about preserving heat, but also give the air exchange that's required in order to properly ventilate a building? It's quite interesting. I've learned that the word ventilate is too complicated apparently for people, but actually it is actually a key idea. It doesn't mean necessarily opening the window. It means the way that we exchange air within a building in order to keep it fresh. So I think that one of the challenges, how do we do better heat recovery and while ventilating a building well?
Okay, and I've got a question here from Alison, which says, as we take homes off the gas grid, how do we ensure that we don't see an increase in the use of solid fuels for secondary heat with detrimental effects on both indoor and outdoor air quality? Are we just hoping that buildings will become so well insulated that secondary heating will not be needed?
Yeah, I don't know if we're hoping that. I mean, that's an element, I think that's the element of the challenge we were just talking about with ventilation, isn't it? And the role of secondary heating. I think you're seeing government policy, in DEFRA in particular, develop around the use of solid fuels indoors, and in some senses looking to mitigate against that, particularly around wood burning and the like. So I think that it's something that has to be considered. I mean, I think this is the challenge that Kate was talking about this, always as you develop policy, having secondary impacts of that policy and taking a more holistic view of the impacts. So I think that's something that does remain important. And I think actually it's got to be joined up policy has got to be the answer to some of this, as well as I think public understanding of the impacts of such secondary sources of heat in the house and their potentially deleterious health impacts.
I think this is the systems of systems again, isn't it? Because I think there's another question which is very similar about the potential impacts of local air quality on net zero measures and potential for increased NOx if you've got more hydrogen combustion and things. I think similar as question. I'm going to ask one last question from here, which is from Jay. How close are we to paying for air quality in general as we pay for water and food to be a certain standard?
Oh, that's a really interesting. So air is thought of as a global commons, so I think that's quite interesting. I don't think the answer to the question is not very near, isn't it? I'll tell you just one. If I've got 10 seconds, I'll tell you one very brief story from something I saw this week, which really, really intrigued me. So they were talking about how to make electric cars work and recharge electric cars. And the question was, if people knew the cost of electricity, and electricity had different costs at different times, would people charge their cars differently, was the question. So I don't know if you know, 5:30 to 6 o'clock is the most expensive half hour of electricity in the United Kingdom. So if that costs you 3 times more, or 4 times, or 5 times more to charge your electric car in that half hour, would you not? And if you charge your car in the middle of the night, would people charge their car in the middle of the night? It was half the price if it was in the day. So I think some of the questions that we're going to face in the net zero space are whether cost and pricing mechanisms will affect behavior and the way that we use resources, in this case, like electricity. So my challenge back to Jay is, if we could cost air quality in some way, would human behavior respond to that cost structure?
Thank you, Paul. I think it's a very interesting question to leave us all thinking about there. Thank you ever so much for your talk this morning and for the questions in here. I'm now going to move on to our final talk of the morning. I'm very pleased to welcome Professor Alan Penn along. Alan is the Chief Scientific Advisor from the Ministry of Housing, Communities and Local Government. I know has been very heavily involved with things like building regulations and that side of the process here. So Alan's going to talk again about the policy challenges associated with air quality in buildings in urban environments. Over to you, Alan.
Good morning. I'll just try and share my screen. See how this goes. Everybody see that?
Yes, we've got you there.
Very good. Okay, so I've nicked a presentation that was it's probably a couple of years old actually, from Go Science, but it's really useful and comprehensive. And so I thought I'd go through the way one might think about the landscape that indoor air quality takes in thinking about government. So, I mean, the slides say it all really, but there's really worried about the number of stakeholders, the divisions. It doesn't sit in anybody's particular remit. And that's probably, from a policy perspective, one of the key challenges around indoor air quality. It's also quite possible that people can be doing what they're supposed to be doing to the regulations, TfL for example, but actually those regulations may not be good enough. There still may be harms occurring. And then there's, it's worth thinking about what other governments are doing around the world. It's an aspect of policy which is going up the agenda all over the world. So, number of different stakeholders are concerned with air quality. Government departments, the main ones, BEIS, you've just heard from, but obviously DHSC, Department of Health, my own MHCLG, and DEFRA. DEFRA, of course, are the owners of the Environment Agency, and there's a major contributor, if you like, to policy in this area and to monitoring and so forth. Other department stakeholders in government, well, the UKRI fund of research, NICE is developing guidelines and has developed guidelines. The Greater London Authority and the major metropolitan authorities, of course, are doing things to handle air pollution through enhanced zones within cities and so forth. And the Public Health PHE did a report on the costs of this in 2018. Charities, the whole list of them you can see, and industry are not unengaged with this. There's a lot of work going on in various ways to think about indoor air quality. Around the world, a whole lot of work going on in different places, and here's a sample of them. These are very various, but concerns about volatile organic compounds of various sorts, those nasty emissions from materials, plastics and carpets and so forth. There's a lot of work going on to try and develop programs of air quality management. And those have led to some legislative action. So Denmark has developed a code, France has been regulating on VOCs, Germany again on VOCs, Belgium on VOCs, and Finland have a voluntary emissions classification scheme for building materials. So what challenges are there? Well, the primary challenge is a lack of evidence and probably lack of funding for research. That's beginning to be addressed now. So the small size of the research community, I think, is important. You're a small but elite cadre of the research community, but this is much less perhaps than the scale of the challenge, if you like. So that's something to be built up. Dispersed responsibility across government, and then funding to date has been provided mainly by charities rather than by the research councils. So the research councils are now building up their research in this area. And then from a public perspective, there's a lack of information, really. That means that sort of the public are not necessarily enabled to make the best of decisions around this. So this is really just to go through that set of issues. I think it's worth considering technologies. So they're not very well developed, the technologies, either for monitoring or for doing anything about air quality. There are a whole range of things being produced to purify air and so forth, but nobody really knows how well they work and whether the claims made by those who are selling them are worth the paper they're written on. And so there's a gap here in terms of knowledge. Dispersed responsibility across departments, well, that's no surprise. We have Whitehall is a big place with very different issues dealt with by different players. And in this area, there's no single sort of coordinating function. That's something we should really be thinking about. So what can we do about it? Well, we need more research in order to understand a series of key areas of lack of evidence. Understanding how chemical cocktails interact and what the health impacts of these are is obviously an important question. Research funding, it's just not adequate at the moment, and it is being built up, but it is certainly probably nowhere near as much as is needed. Very small percentages of research on pollution go to things like indoor air pollution in particular. There's more work going on outdoor pollution. There are key players around, and this list is 2 years out of date, so other players I would include on my list today, but it's a small community, and it's a small community that needs support and to be built up. Public information, again, lacking. The dispersed challenges across government I've talked about, and the limited understanding of different monitoring, filtration or ventilation technologies. Again, the questions that you were just handling there at the end of Paul's presentation, turn around these. What about mechanical ventilation systems? How acceptable are those in people's houses in particular? These seem to be problematic. One of the things that, of course, we are doing is by sealing up our buildings better with double glazing and, replacing the windows and so forth. We are reducing the level of ventilation in those buildings. Unless that gets replaced, there are challenges. A lot of the challenges actually come from gas cooking, and cooking by gas is problematic. That may change, of course, as we move over to electric or move over to hydrogen. I think there's a lot of interest in that, the hydrogen transition potentially to replace gas. It doesn't come without its own problems, though, because burning hydrogen can lead to nasty NOx emissions, unless it's done in a particular way. And I'm not quite sure how much is yet there in the way of appropriate burner technologies for hydrogen to limit NOx emissions. Public information, well, it gets out there, doesn't it? We've all seen the paper headlines about how toxic London's underground system is, and that's something which people do worry about. But how balanced are reporting on this? Well, actually, there's just a lack of information out there, and I think that's something we should all think about. Opportunities to do stuff. Well, we could better direct policy towards this by understanding the evidence base. And I think that's really important. We need to build up more evidence, and clearly this network is a part of that approach. We need to include more research funding for indoor air quality and air pollution research, and we need to grow the community. We need to encourage more cross-departmental collaboration within government and improve public communication. So I think those are really important. And then we want to, I think, build up on capitalizing on emerging technologies. I think this is an area where industry needs to really step in and help ensure that what we do is the appropriate thing. So in MHGLG, our particular interest is through two runs, I suppose. One is through the planning system, and the other is through building regulations. So local authorities have a duty in planning to ensure that development doesn't pollute. Although MHGLG doesn't regulate outdoor air pollution, DEFRA and the Environment Agency hold that kind of remit. It's very important that local authorities take that duty seriously in considering planning and for development. Now, it tends to crop up when people want to do another waste to energy plant in some area, and then everybody gets very worried about the pollution effects. The more broad issues don't really come across the planning picture, if you like. It's a really difficult area because people can't see the pollution, and if those, as soon as you put on a big smokestack, people worry about it. But aside from that, they don't really get the relationship between pollution and the planning system. Building regulations, well, we're currently carrying out a review of our ventilation regulations. We're looking, so research has been published on ventilation alongside the Future Homes Standard, and approved document F sets out the criteria for ventilation. Also guidance on location of ventilation intakes relative to pollution sources, and so, not putting your mechanical ventilation intake next to the car park parking slots is one of those old hackneyed things, but it is one of the things around which we regulate. Evidence gaps. Well, it's worth having a think about these. So there are various studies to date, and I've got these coloured from sort of green to yellowish, according to how much evidence there is out there. Particulate matter, a lot of evidence around particulates, allergens, radon, well considered, carbon monoxide. People understand the health impacts of these things. And then as you go down to nitrogen oxides, volatile organic compounds, and down to the issues of how movement of pollutions between outdoors and indoors takes place, less and less research out there and less understanding. And so I think these issues, movement between indoor and outdoors, the issues of ventilation, what can we do about this, are areas for real development in future. Understanding the relationships between the chemistry of what's going on and the relationships between cocktails of different pollutants, their health impacts, and the long-term studies of health impacts are important. There's a behavioural dimension to this as well. We've talked about the use of solid fuels, replacing other aspects of how we heat space. Well, actually, I have to be honest, I've got an open fire and I do use it from time to time. And there's no doubt that it's a challenge environmentally and in terms of health potentially. But there's a behavioural dimension to that. People sort of like it. So what do we do about that? And then the technological developments of better monitoring, better filtration, and better ventilation systems. What does the stakeholder landscape look like? I thought you would find this useful. A whole range of different stakeholders, some of whom I've mentioned already, the charities, the other government stakeholders, the main government departments involved. and then the industry players. And other stakeholders, how they're actually interested in this. Well, there's a whole range of different ways that the charities in particular and industry are involved. Passive House, very high standards of energy efficiency while trying to maintain indoor air quality with trickle ventilation of various sorts. But those are just sort of examples. And I think that's where I shall stop and take questions.
Thank you very much for that, Alan. And it's good to see the government landscape on this, and the thinking that I guess really has led to these networks being formed. You know, and for us to be really looking at this indoor-outdoor exchanges. So I've got
sharing this thing.
Sorry.
I wonder how I stop sharing screens here.
That's a very good question.
No idea.
I'm not entirely sure. I think
I might just close it and see what happens. Oh no. Oh yes.
Yes, yeah. That's taken you off. Yes.
Right.
So I've got a couple of questions in already. So one from Bryony, which asks, what measures are you taking to support trades carrying out permitted developments to create healthy, climate resilient indoor environments? It's possibly quite a big question.
Sorry, say that all over again.
What measures are you taking to support trades? I guess that's organisations and companies and things carrying out permitted development to create healthy, climate resilient indoor environments.
That's a very good question. It's probably a very good question. Permitted development, of course, in the planning system is something that is quite contentious. It's been adopted as a method to try and get additional homes built, for example, or commercial premises turned into homes very often. So when your local pub is converted into a set of flats, it's to do with permitted development rights being opened up. The relationship between that and issues to do with air quality, I suspect, don't appear on anybody's agenda whatsoever. The local authority will say, well, that's just a matter for building control, and are people doing what they're asked to do to the regulations? And I'm afraid that that's the point at which everything just sort of disappears. So my suspicion is not very much. Loft conversions and ground story extensions we're missing at educating small trades.
Okay, so yes, so that's a very interesting question, which is, you know, if you've got people who are doing these types of conversions locally, but they are less aware of the regulations and understanding.
So I think, I mean, this is really interesting. There are a whole series of initiatives around skills, and these actually fit far more into the whole sustainability issue than they do into the health and air pollution issue. But there is no doubt that one could incorporate into the training programs for small trade members work on the health and pollution aspects of or implications of what they do. So the importance, for example, of the ventilation slots that you have in your windows, and educating your customers to the reason why they shouldn't just stick a piece of tape over them and not open them, that the draft is actually a good thing. That's something that I think tradespeople can be very good at. And in my experience, they are, when they're trained up around things like why you should be using K-glass and so forth, they're very good at communicating that to the lay public, and they are key stakeholders in this process. So I think they're somebody we should think about from that point of view. I think it's a good suggestion.
Thank you, Alan. Another question, which is from Emma, which is, could you elaborate on what is being done to enable greater collaboration between government departments?
So, I mean, one of the interesting things, I'm a chief scientific advisor, as Paul was, that you've just heard from, and we meet up at least once a week with Patrick Vallance, and we have our meetings and roundtables across all the government departments. And so that's one place in which a discussion around this kind of thing can take place. I would say that when we come to sustainability and climate change and energy, there's a massive international sort of thrust on this. We've got COP26 coming up. There's a whole range of government focus on the set of issues, which are, of course, cross Whitehall, cross everything. The same doesn't really exist for the health-related issues that we're just talking about here in terms of indoor air pollution. It could do, but it hasn't yet taken on that same level of centrality, I suppose, in people's minds. Now, it's possible that COVID will be the stimulus for this, because actually, guess what? To make your premises COVID safe, open the windows, do more ventilation are key issues. And we already have people saying, well, what about energy use and the implications of that? And is it viable in winter and so forth? So I think this is an area where perhaps one of the outcomes of COVID will be a greater focus on indoor air quality and indoor health. But I think it does require a much higher profile in government. Certainly the Science Network, Science Advisor Networks, is one of the areas where that would take place.
Thanks, Alan. I've got a question here from Jim, which asks, how might planning and building regulations support or embed minimisation of exposure to indoor air pollution in the future? So I guess that's thinking about using a regulatory framework differently.
So I've mentioned that we're reviewing ventilation regulations. I think that's one part. I think the other thing that's coming up is the new product regulator. So there will be a new regulator for construction products. And so all the issues of volatile organic compounds, off-gassing out of paints and carpeting and textiles and other building materials is one where that regulator may well be able to play a role in helping to sort it out. This is a long-term game, and they have many different things on their agenda, not least of which is fire performance of building materials, which is the real reason why this is being done at the moment. There are crossovers between this because fire retardant compounds are pretty noxious, and there's a big increasing lobby group around whether or not we should be allowing those retardant compounds in construction materials, or whether we should be using materials that are inherently non-combustible. But that's all part of it in answer to that question, I think.
And I've got a question here from Andy, which he asks, in terms of emerging technologies, do you see consumer Internet of Things type devices taking a larger role in guidance and regulations for indoor air pollution or IAQ in the future? I know you've touched on some of these for standards for other countries, and I'm aware myself that Belgium put in a carbon dioxide standard, and actually that's becomes quite challenging. So what, have these things been thought about, and if so, what would be needed?
I think they have been thought about, but I think there's no consensus yet on how best to do it. And there are real questions here, to my mind, about the feasibility and effectiveness of monitoring, particularly if you start to want to monitor for things other than carbon dioxide, carbon monoxide. Now, carbon monoxide is seen as, it's a safety thing, and what you're looking at is noxiously high levels of carbon monoxide. However, I suspect that it goes along with a whole range of other pollutants and would be a fairly good proxy for you've got a problem. But we probably measure it at much too high a level rather than at the low levels where the pollutants might be a concern. So I do sort of worry about this. You burn the toast every morning, all the smoke detectors go off. Guess what? That smoke itself is a pretty nasty compound or set of compounds, mix of compounds, which should come out into the atmosphere. We've set the smoke detector off because we're worried about house fires. But actually, if you were really worried about this, you would be not cooking on gas. You would be not cooking things that burn and grilled, and you wouldn't be using that skillet to do your steak and all of those sorts of things, because those are really nasty compounds that are coming off all of those things. You have to be really aware, I think, of whether it's we need a monitor to tell us that, or whether it's a behavioural and public health education issue in the round. Your nose is a very good monitor.
I think we're demonstrating there's a lot of complexity in here. I'm going to ask one more question, which is adapted from Alison's question, who says about how should your neighbours design their ventilation system to avoid sucking in the emissions from your chimney? There's a serious problem for a lot of people who are not able to ventilate on winter's evenings. I think that's a really interesting question. I'm not expecting you to tell me how to design a ventilation system, but do you think we need any regulatory changes here to think about how one person's actions impact on another person?
Do you know what? I'm always completely surprised. I live in London. We've had Clean Air Acts since the 1950s, and yet the number of premises which are burning logs, up and down the road. Now, it's nowhere near what it used to be in the 1950s when we had the great smogs and so forth, but people are not burning smokeless fuels. They're burning smoking fuels, and it's problematic. My next door neighbour, I can tell you, I have to shut the windows in the summer because they like their bloody barbecue just down the back, and the house fills with smoke. Anyway, I think neighbour pressure, peer pressure is one way of doing it, or close your windows when the occasion happens.
And I think it is a difficult one, and I think you're right about there's a lot of people who are in a smokeless zone who just disregard that and believe they're the only one. I think we'll draw that to the end of the questions there. Thank you very much for your talk. Thank you to all the speakers from this morning for very different, very interesting talks, which really set a lot of the contextual challenges that this network will have to deal with. So although we will not solve all these problems, we won't write the regulations, it sets that research context for us to think about how we can understand the complexities of indoor and outdoor flows, and how we can build the right models, right tools, right approaches to tackle those challenges and think holistically across the health and air quality challenges there.